Good morning, good afternoon, good evening to all of you. We're going to get started. I'm Etienne Krug and I'm director at the World Health Organization for the Department of Social Determinants of Health. I'm really delighted to welcome you all here. The world is knowing very difficult times, as you all too well know. It's tough for everybody. It's particularly tough for the older people who are more at risk of COVID-19 and also at risk of social isolation. We have a short event, so I will jump in immediately. We're very fortunate to have with us Dr. David Nabarro, who is the head of who is a special envoy of the WHO Director General for the COVID-19 response, one of 6 of them. He's also the executive director of 4SD, the agency that co-hosts this event with us. David, can you hear us? Let me also mention that in addition to David Nabarro, we have Dr. Hans Kluge, who is the Regional Director for the World Health Organization's regional office in Europe. He will be speaking right after David. David will be speaking for 20 minutes and then Hans will make some remarks based on David's speech, and then I will close. We would have liked to have more live interaction, however, due to the short time, this was not possible. We did collect questions from many of you all around the world. Thanks for sending them in. We had a huge amount of questions. We tried to summarize them and have provided them to David so that he can address them while he speaks. And hopefully most of those will then be addressed through David's remarks. Thanks very much. David, thanks so much for being with us. I can see you're here now. Over to you.
Thank you very much indeed. It's great to be connected with all of you. And I'm very, very pleased to have a chance to serve as the one of the World Health Organization's special envoys on COVID-19. My work is to directly link with the World Health Organization Director General and the regional directors as we work together to respond to this extraordinary crisis, which is quite unlike anything I've ever known. And I believe for most of us, it's unlike anything any of us have seen before. I'm particularly wanting to focus today on the reality that in most of the outbreaks that we're having of COVID right now, older people are particularly at risk. And it's really, really important to be connecting with all of you. Now, one of the outcomes of this reality that the illness and death rates are greatest amongst older people and people particularly with other conditions besides COVID, is there's a kind of stereotyping of older people in public discussion about COVID. They're identified in several different ways. There are certain people who say, well, it's the older people who are most at risk, so therefore we should kind of accept that younger people are going to be fine, and we sort of just see the loss of older people's lives as a sort of collateral damage. I'm very pleased to see that the world as a whole has not gone down that pathway, and that we are recognizing that every life has value, and we're working to try to preserve and protect every life. And the negative narratives that have occurred, I think, have occurred from people who just don't think. But as soon as they realize that it could be their parents or their relatives or the people across the road who are full of the wisdom of the world, that these people are at risk, then they do shift. And I'm seeing that shift, but your collective role in maintaining the reality that every life matters and that we must work to ensure that everybody is able to be protected against this disease is so important. I'm picking up on questions that you sent in during the week, and I'm going to really be grateful for all your contributions. You know, it's so wonderful to have these opportunities to connect with people who in turn are connected to masses of networks. And I am hopeful that what we do will be helpful. And I'm so sorry that Zoom occasionally leads to some interruptions. I'm actually blocking my screen so that I can talk directly to the camera without distraction. Now, there are some restrictions being imposed on the lives of people in order to help them to protect themselves during this particular series of outbreaks all over the world. Some governments have asked older people to stay indoors and to shelter, and I think that's right. But what an awful consequence it can have, especially when terms like social distancing are used to apply to what they do. We ask people to be 2 meters apart from each other because that gives people a chance to actually avoid being infected with the disease, which is carried in droplets, in coughs and in sneezes. But that kind of restriction, what does it do? It increases the social isolation of a whole segment of our society, of people who really do need to be connected. They can't get visits from the younger relatives. They're often the services that are provided, Meals on Wheels and so on, are not there. So I am really keen to encourage everybody to actually reinvigorate existing community networks, whether it's through church or through local societies or simply through neighborhood groups. Please do everything you can to maintain connection. If necessary, you have to do it through techniques that encourage physical distancing, but using telephone, internet, WhatsApp groups and the like to promote social cohesion and to support the inclusion of old people. Because what we do know that already the kind of measures that are being required are actually leading to some degrees of psychological disturbance and mental ill health. And I'm hoping that my colleague Hans Kluge, who's on this call from the World Health Organization's regional office in Copenhagen, he's the regional director, will be able to reflect on this as well. Mental health matters. Well-being must be maintained, and we need to do everything we can to ensure that those people who are feeling stressed and disturbed can actually be supported. And that's where trying to make sure that people get support from others for their daily needs can get that. And that does mean looking after the shopping, looking after getting medicines or medical devices, or simply just trying to help with basic daily functions. There are challenges because I know from personal experience that caring means contact and that carers have to have physical contact. And so there we need to encourage the carers to protect themselves. And there have been some unfortunate situations where people in residential facilities end up being exposed to COVID because carers have brought the virus into those facilities. And I'm asking all carers, wherever they can, to be very, very careful about practicing all the necessary pieces of etiquette, and if necessary, and always, if they're up close, to be wearing masks, because sometimes they don't know whether they're carrying the COVID. And so it is difficult if masks and the like are not available. I do think people in care homes will need special attention. I know that in some countries, visiting care homes has actually been prohibited. And I know the reason for that, because of the very large degree of morbidity and unfortunately mortality in many care homes. I think we have to work hard to find ways of dealing with this and use as much as possible, use various different techniques for connecting with people for videos and the like, and trying to make sure that they can maintain contact. If old people can, they need and use them, they need to have things like tablets and so on to enable them to be connected. When we were doing work in Ebola, just an example, and we worked this out with local communities, instead of using white plastic, as was tended to be the case, as the sort of screening around Ebola treatment centers, we used clear plastic. And then visitors, it couldn't necessarily be in contact, but they could at least be seen and they could wave and they could smile and they could dance. And it was great for the patients to be able to be in contact. So these simple things like just trying to find ways in which it is possible for old people to be able to see out of their windows or something like that makes such a difference, so helpful. Now, I do think that we should avoid implementing any protocols that put priority criteria based on age discrimination, but at the same time, it is our responsibility to point out the particular risks experienced by older people. And if we can just try to find a way to be risk focused without at the same time discriminatory in our protocols, that would be useful. So thank you for raising that point about the fact that some protocols are a bit discriminatory. The humanitarian response plans and other plans of international organizations do need to recognize that older people do face risks. And I'm actually very pleased that in the UN Secretary General's report on social and economic consequences of the pandemic, he has picked out the particular issues, but we've got to keep pushing it. And with all of you being so active, you can make this point. Some people say to me, why isn't there a UN agency that's specifically responsible for the rights of older people? I say that could be a mistake. I actually think it's very, very important that every single part of the UN family needs to recognize the importance of older people in our societies as the curators of our wisdom and the people who reflect our values. And I would like to be sure that the particular needs of older people are paramount. And I hope that as a result of this pandemic, we will all learn to respect older people much more, because we're focusing much more on the circumstances under which many of them live. But I have a particular concern, and one of you brought it up. Actually, I have a son who's quite seriously disabled. He's got tetraplegia, and he depends hugely on really constant caring. He's also not very able to do things for himself. In fact, he can't move his arms or his legs. And I keep thinking, are the interests of disabled people being properly taken into account in strategies for helping communities to cope with the impact of COVID-19? And I actually would like to see special attention paid to people with disabilities. Now, are the technical guidances being provided by World Health Organization and others actually being implemented properly? One of the things I'd like to propose is that whenever we're thinking about strategies for addressing COVID-19 in communities and for trying to interrupt transmission and protect people most at risk, at the same time, we do ask for older people themselves to be incorporated in thinking. They know the issues they face. We don't. We speak on their behalf, but have we a clue? Often no. I mean, I sometimes think I'm in the older person category, but I think that it's really important that people who are older than me, who are less able than me, who perhaps can't hear, who can't move around very easily, they need to be involved in the thinking about what's involved. They need to be involved in telling us how to reduce their social isolation, their mental ill health. Now I'm going to talk a little bit about the problems of triage and measures taken, the practicality of this. And I wanted to look at three questions that have come in that help me with this. The first was about media stories about countries prioritizing people under a certain age for intensive care, or when they're making choices about who should receive care, again, focusing more on, making choices about whether care should be stopped, actually saying, well, older people perhaps should be stopping treatment first. Well, actually, I think that we need to be very, very careful about this. And I do believe that protocols for triage must be based very clearly on both the scientific evidence that's there to tell us what works and what doesn't work, and the medical need. Actually, our colleagues in China did teach us an awful lot about how to come up with the best protocols for use in different circumstances. They revised their protocols 6 times during February, and they found that having a standard protocol really helped. And new scientific evidence is coming available all the time on what works and what doesn't work. And I do know that WHO is looking really hard at these issues. I'm saying that my colleagues in the WHO emergency program. I personally think that singling out older people for very specific measures will probably help them to survive this pandemic with less harm, because it forces us to look at their specific needs. But I'm also super conscious that if you really do place a special emphasis on older people, you run the risk of them being categorized, them being moved around, perhaps even feeling that they are sort of stereotyped and even increasing stigma, what we were dealing with in the first questions. So I think we need to all the time be balancing on all these issues. It's a balance. You can never, ever have an absolute certainty that you will do this or that. And governments everywhere are having to balance priorities. So I don't like to see actual measures imposed on a particular section of society, but I would like to see debate with older people in order for them to say how best things can be done. And I think that we are going to face difficulty, just being honest with you, in large slums, particularly in low budget settings, where you've got everybody put together, and actually enabling older people to be protected is going to be super hard. I don't have a solution to that. I think each community has to know what the risks are and has to work out for themselves what they're going to do. In my post-pandemic vision, I'm coming to the third area now, thinking about the future. I believe that we're going to have to learn to live with this virus for the foreseeable future. People say to me there'll be a vaccine in 18 months. I say perhaps, but we don't know. Coronaviruses are not easy to develop vaccines against. And so we're going to have to be very ready for the possibility that we're going to be living with this virus for some time. And how are we going to do that? Well, we're going to have to be creating defenses in society that enable us to live with the virus always as a threat, to contain outbreaks of the virus very quickly, to do it with dignity and honesty and authenticity. But that's going to be the future state. And I actually think this will fundamentally change the way in which we approach healthcare, the way in which we work with older people, the way in which we actually function in society on health. And I think the policy discourse on healthy aging will need to take account of the post-pandemic reality. And we will need to be sure that the interests of older people are taken into account in all decisions. Yes, as one of you has written, older people are in the eye of the storm in the context of COVID-19. But I believe that through this, the position of older people in society will be given far greater attention. And all of you who are involved in the decade, I hope you can build on what's happening and use it as a springboard for a much better strengthening of the position of older people as absolutely vital members of our society, and not people to be forgotten about or left alone. And that's why, to the last point, the role of civil society organizations right now, you are so important. You are able to be the voice and the representation of your community in local, regional, national, global discourse. And I want you to do it. And if there's anything I personally can do to encourage you to be strong, to encourage you to speak out, but to do it in ways that reflect the fact that other people are dealing with other priorities. So it can't be done all the time with confrontation. It's also got to be done, as many of you do, in a spirit of solidarity and harmony. That will be absolutely the best. I know that you're struggling. I heard just now on another call with probably some of the same organizations that you are, that many civil society organizations are experiencing terrible problems with fundraising right now. Donations have come down. Private sector sponsors are not so easily passing their cash, and the donors are being a bit tight. But honestly, I think that we need to make the point that this is where civil society really matters. This is where community organization really matters. And we need to work together to stress that it's the society-based organizations, the so-called NGOs, it's a funny title, isn't it, to be called a non. I say the very powerful and important civil society organizations have such an important role to play. I was talking to colleagues who've been working in China on this, and they remind me, governments can't do it alone. They have to do it in partnership with their people. I was talking to colleagues in South Korea, and they said, we are so dependent on the business organizations, I think they're called chezols, but we're also dependent on civil society organizations. Our disability organizations are organizations representing older people, because without these organizations, we can't connect. And then I'm hearing from people all over Europe and the US and India and Africa saying, what really matters is the networks of civil society, those networks that can connect. We've been writing narratives, you know, it's how we've been doing it, sort of things that come together that reach us. And we've been doing it about every 3 days and posting them on our website. And I expect we'll tell you where they're available. If you believe that there is more that we can say about the role of civil society organizations in reflecting the interests of older people and in ensuring that older people are getting the right attention in national strategies, do let us know. And with that, I'm going to stop, and I hope that I can hand over to my colleague, friend, and somebody who I really, really am delighted to be working with, Dr. Hans Kluge. Hans, over to you.
Thank you so much, David. And hello, Etienne, and all colleagues and friends. Hello from Copenhagen, from the WHO Regional Office for Europe. And indeed, it's this morning at our weekly press conference through Facebook Live, the main theme was healthy aging and the elderly. And in fact, Alena from Etienne's team was participating, and David was giving a wonderful input. So I will not take too much of the time. Let me put forth 3 points complementary to the inspiring speech from David. First is, while indeed the older people are at high risk from COVID-19, I would like to quote a colleague from mine recently who was telling, young people are not invincible neither. So it's really a responsibility of all of us. Hence why I agree with David that we shouldn't do a triage on basis of aging. We're all in it. My vision for Europe is called United Action for Better Health. We have to be united here. All of us have a responsibility not to be infected, and if you are infected, not to infect other ones. Number one. Number two, a plea to the health and social workers, because particularly nurses and informal carers and social workers taking care of elderly people if they are at home or in elderly homes. And if we protect them, we protect the elderly people with who they are in close contact. Some of the nurses were telling me, Hans, now we're getting so much attention and it's the year of the nurse. Why did we have to wait for a pandemic until we got so much appreciated? So I reassured them that this is something we will continue to advocate for after the pandemic. So one, business of all of us. Two, the health and the social workers. I'm very concerned because Europe is the epicenter now of the pandemic, with 10% of the patients being healthcare workers. But let give me a good example of my own country, Belgium. There is a Flemish Older Persons Council. And despite of the increased workload, nurses are still taking the time to arrange communication between residents and their relatives through phones, social media apps, to foster the contact and reassure them. And it comes back to David's point on the mental health. Social connectivity is so important. If I speak to the youth, I tell, if you cannot see your grandparents anymore, call to them, call every day. Help them to make wisdom of this infodemic of information. Help them with a daily routine. Even for myself, for my 2 daughters at home, a daily routine is so simple, but often overlooked, very important. And healthy habits. Little bit of exercise. In Denmark, for the elderly people at the national television, 9 o'clock in the morning, the whole country is singing old Danish folk songs for the sense of belonging, and stay away from tobacco and alcohol. So one, everyone's business. Two, a plea for health and social workers. And three, a plea for the solidarity to reach out. We saw it in the heat wave in France years ago. Elderly people pass away in the neighborhood and they were found their bodies days later. You don't hear from your neighbor. One day, reach out to each other. And I'm very much looking forward to all your knowledge, because WHO is not that we know better. We're collecting the knowledge and giving it back to you for adaptation. Thank you, Etienne. Thank you, David. Thank you, Alena. Thank you, everyone. Good luck to all of us.
Hans, what a lovely thing to say, that actually the knowledge that we're getting is the collective knowledge. It doesn't belong to any one individual or institution. It's our family of actors, all of us working for the well-being of older people, who are collectively harvesting that knowledge and sharing it. And I like it when you say that the World Health Organization is actually kind of assembling all that knowledge and rebroadcasting it. And I think that's what more and more we're learning we have to do. It's all a two-way process. Thank you also for the very important point about keeping ourselves in good form. And I love the example of the 9 o'clock daily folk singing in Denmark. Perhaps that's something we all need to do. And great. And I'll try to tune in if I can. So it's an absolute delight that you're here with us today. I love the way you lead, but I'm also wanting to really respect my colleague Etienne Krug. We've worked together on and off for quite a long time, and we've done quite a lot of things together, Etienne. Thank you for your imaginative leadership on this work, and particularly for helping to advance the decade of aging. Could you take it over and finish the show?
Sure. Thanks very much, David, for the kind words, and both of you, David and Hans, for being with us. I know your time is extremely precious in this difficult period. So thanks for having taken the time to join us. In a way, it's very ironic that as we are almost adopting a decade of action for older people, we are facing this situation. But as both of you have said, I think there's a lot of lessons to be learned from what we are going through, and hopefully we'll end up with a much better world. So thanks very much for addressing the many questions we received, more than 50, David. I think what you provided was very helpful, and I think reassuring for everybody to hear how central the thinking is around making sure older people are taken care of medically, but also socially, and that we keep them in mind throughout every step of the response. And as Hans said, we're all in it. Hopefully we're in it to make our world better. And thanks to all of you for joining us today. There are constant updates on the WHO website, on the epidemic, of course, in general, but also on the response for older people in many different aspects, as well as on the website for the Decade of Action for older people, which will receive also the posting and the recording of the event today. So thanks to all of you. Have a great rest of the day. Bye-bye.